you can go back in time and look at the most successful companies, in the history. You can
Hmm.
look at Apple, right? You can look at Netflix.
Hmm.
They started out gangbusters in the beginning, and then they hit
Yeah.
a snag, right? Sometimes it's really about, what skill sets do you feel that you are not only comfortable and good in, but how
Right.
you can apply to an area that you really like.
Hi, and welcome to Margin Emotive Podcast, special edition for Future of Healthcare Decal class. I'm Jason Lee, your host, and today we have a special guest, one of our speakers from the Future of Healthcare program, Don Briones. Don, welcome to the show.
Thanks, Jason. Happy to be here. Appreciate it.
So Don is a managing director at FTI Consulting and a former healthcare executive with over 2 decades of senior financial leadership experience. Don has been, in the driver's seat of major health systems, medical groups, and today he advises organizations through many of their most critical periods of restructuring and transformation. Don, you have seen the business of care from every possible angle. Welcome to the neighborhood.
Yeah, thanks, Jason. I appreciate being here, and I appreciate being part of the podcast.
And so, listen, you and I have been part of the Future of Healthcare series at Cal. Obviously, very proud to be part of that as a proud Cal alum, and I know
Absolutely.
you are too.
Absolutely. Go Bears, man. Go Bears.
That's right. That's right. So we talked to the students in the program, and I know we've got a lot of students and grad students and early careerists listening to the podcast today. You've spent a lot of time, 10 years, 15 years, 20 years inside hospitals, inside medical groups, and even physician enterprises before you kind of went into consulting. But as you look back at some of those experiences, what are one or two of the highlights of those experiences that you'd like to share with the students today?
Well, a couple of things, right? Because I actually have toggled back and forth between being in industry and being an advisory. So I can almost speak to one or two highlights in each of those particular areas. But
Right.
in general, with healthcare, I would say one of the main highlights is really staying close to really what is key at hand within healthcare itself, which is really understanding how we can help communities, right? No matter whether if you're in industry, whether you're clinical, whether you're in finance or in the business world, whether you're advising from an external perspective, helping out, it really comes down to how are we helping healthcare organizations with the mission that they're trying to serve? And while there's different types of organizations, they really do try to focus in on the same thing, which is the patients. And I think a lot of my highlights and the main highlights involve, you would think that it would be some big event or whatnot, and I do have a few of those, but really it comes down to really those moments where, you can really see the patient actually knowing that they are getting the care that they're serving, and that you're doing it in such a way so that they are getting what they believe value. One of the main highlights, it may be a shock to some, is the times when I remember in industry, I would get personal calls from patients because they've had a major event in their life by being in a hospital or having their family member being in a hospital, and helping them out because they've gone under financial hardship and been able to help them with some kind of financial aid, some kind of way in which to help them out that in the end they weren't expecting. And getting some of those personal phone calls really is what I remember a lot. I mean, do you want if you want one major highlight, Jason, it really is about, I mean, I remember, oftentimes in my career where, you always have to replace hospitals and replace facilities, and really the notion of actually watching, being part of the planning for a new hospital. I was involved in El Caminos in Mountain View, California. As a consultant, I was involved at, a number of different ones, the UCLA's Ronald Reagan facility, a few of them all over the country, and really being part of the planning of that and watching the facility actually grow and opening for patients was really, I think, one of my main highlights.
Yeah.
Because you can really see everybody just really see the fruits of what the work that you do.
Yeah, no, and I can imagine that would be a very prideful moment. I'd imagine also that as the money man at a healthcare system, sometimes you have tough conversations or decisions, right, around charging patients and whether or not. Have you ever had a chance? Have you ever had an instance where you had to deny care because families couldn't meet the financial obligation, or any tougher conversations like that in your career?
Well, I mean, the tough conversations often have to do with affordability, as you said, Jason.
Mm-hmm.
And,
Mm-hmm.
with healthcare, particularly in nonprofits, it is one of those policies where, and I've worked in the industry and organizations where we've never turned any patient away, irrespective of whether they're of their ability to be able to pay or not. What
Yeah.
becomes difficult is really the hardship involved in terms of what they are able to pay and what are the
Mm-hmm.
different ways we can actually help them. And there have been cases where it was difficult. I mean, you can see how much burden the finances have been put on folks, and we try to find different options. And sometimes, unfortunately, we were not able to find options, even with some key financial aid and everything.
Right.
What many organizations provide is a form of charity, but sometimes patients may not even be able to qualify for charity. So,
Yeah.
we try the best we can, and those are the toughest ones, unfortunately, in the conversations we have, knowing that they've gotten the care, but you can see the burden that they have because they don't want to think about finances at all. They really want
Yeah.
to think about how they can get their family members or themselves healthy and back
Mm-hmm.
to normal. So
Mm-hmm.
it's oftentimes those are the difficult ones, is not necessarily denying care, but really helping them through that stage and ensuring that everything's going to be okay.
Yeah. Yeah. And so your current area of expertise, I know you have sat in the CFO seat for many organizations. Right now, today, you provide services from a transformation standpoint, financial transformation. What does that encompass? Describe for particularly some of the students in the audience, what
Mhm.
that means and
Mhm.
how you bring that service to
Yeah.
these systems that you work
Yeah.
with.
Right. Well, thank you. Well, so at FTI, the firm itself, right, we are known for assisting and working with organizations and other parties that are part of organizations to help them really get through whatever crises or whatever change that is occurring at their time, whether
Mm-hmm.
if it's at the level of growth and growth strategy, or whether if it's in the area of looking at some level of transformation, be it, performance improvement, or whether if it's a financial turnaround, or whether if it is something where there does need to be restructure, and in
Mm-hmm.
crisis moments sometimes involve bankruptcy and helping them through bankruptcy. So
Yeah.
our firm and what I do is I help them through that by helping them look at strategies, helping them implement strategies, whether if it's raising their financial performance,
Mm-hmm.
whether if it's establishing new strategies that'll help them through, and helping them get to the other side so that they can actually avert any additional crises that may happen at that time.
Yeah, and I imagine organizations under distress, just like in industry, the revenues are just not matching up well with the expenses. A lot of folks, and I don't want to get too deep into some of the policy decisions around this question, but a lot of organizations are a little bit upside down in some of their revenue less expense calculations. And as you think about the coverage and the lack thereof, a lot of people have here in 2026. What's your prognosis? What's your perspective on the marketplace, and where we may see signs more cracks in the industry, more cracks in the safety net of providers across the country out there?
Yeah, okay. Well, one thing wanted to have a little bit of perspective of about the healthcare industry, right, is,
Yeah.
it's always been a low margin business, right? There's
Mm-hmm.
always been low profits, and when you have low profits, you end up not having enough. You end up having not as much money to actually reinvest or to grow the business. So it's
Mm-hmm.
important that people or that organizations try to, um, y- you know, take whatever they have in terms of the money that they do earn, and to try to reinvest so they can grow.
Mm-hmm.
And what we've been seeing for throughout time, I mean, even, you can go back 25, 30 years, and you can see that, as much as 30 to 40% of the hospitals in the country are indeed at a point where they have not been profitable at
Oh,
all.
wow.
right? And
Okay.
so, so this has not been just a 2026 issue, right? This has been
Hmm.
an issue over time. And what's interesting is that even during that time, and you have economic downturns like the dot-com
Sure. Financial
issue,
crisis,
right,
yeah.
the Great Recession, and what even COVID, you still see that same 30 to 40%. So it
Hmm.
doesn't go and spike up to 70%. I mean, so it's still the same thing, right?
Interesting. Interesting.
Right. So now we're in 2026, and um, this is a point in time where, because of some of the recent policies and the policies that are going to be enacted, there is a possibility because of how the funding goes to the hospitals, where
Hmm.
we're going to see probably that same 30 to 40. You might go to maybe into about 50%,
Wow.
possibly. The thing that I'm seeing is that there's going to be a lot of polarization in this, right?
Okay.
So
And what do you
many
mean by that?
well, so many of the healthcare organizations that are going to be impacted by the new policies, particularly those hospitals that are heavily in Medicaid populations and government
Right.
care related patients, Medicare, Medicaid, are
Right.
going to see more difficulty in their financial performance.
Okay.
There's going to be other healthcare organizations, however, where they do have patients and a population where they don't see as many of those, and they're actually going to see probably a better performance in a lot of ways. So there's going to be this. I'm seeing that there's going to be
So
this
let's go back to
polarization
that point
stuff.
for a second. So
Yeah,
because
yeah,
an entity has a lower percentage of Medicaid, they actually might be able to fill more of their capacity with commercial patients and actually end up better off, is what you're saying,
that's
because
correct.
that one patient that would have been a Medicaid reimbursement is now a commercial Blue Cross Blue Shield patient,
That's
something like that.
That's correct.
Interesting.
That's correct. And
Interesting.
plus they're going to have the ability to have the means and have the necessary facilities to be able
Hmm.
to see those patients, right? And really that snowball effect I see might happen. Thus the polarization between the haves being strong, getting stronger, and the have-nots
Mm.
not being, becoming weaker as a result financially.
Interesting, interesting. And so when you when you're entering into a, I don't want to say just stress, but certainly a challenged health system that you're working with to improve their overall picture, what's the top one or two areas that you like first look for leaks? Where do you say, okay, I got to plug a couple of these holes, and these are the most common places where I find those holes.
Well, I think the first one is in the area of revenue and
Mm-hmm.
and the top line.
Mm-hmm.
Certainly, there's the obvious around whether or not they're losing volume, and losing volume that actually will help them profit more, right?
Mm-hmm. Mm-hmm.
And to understand and realize, well, what's actually going on there? Why is that patient base not going to that particular hospital? And there's different signs and different reasons why, but oftentimes, it could be one of a couple things, right? It could be that, the insurers might actually drive them to maybe a different organization. It
Yeah.
could be that um, their competitors might just
So
have
you're
better
talking about
services.
network access, like a
Yes,
network benefit
exactly,
question, as opposed to
exactly.
purely an availability question. Yeah.
Right, right, exactly. And so I mean, it could be that they may not be able to collect the payments from insurers as they
Mhm.
once were, right?
Mhm.
That the
Mhm.
insurers are denying the type of services in terms of payment, even though they
Mhm.
provided the services. So oftentimes we look at that in the revenue cycle work that's involved there. The other
Mhm.
side of the coin is on the expense side, and
Sure.
and really really looking at what is required to provide the services, and essentially what is the type of cost structure that an
Mhm.
organization has. And when it comes right down to not only the cost structure operationally, but when we look at it financially, are
Mhm.
we actually dispersing the cash in such a way that is actually, again, reasonable, right? So
Mhm.
there's many ways in which we look at not only from a labor perspective, but also some of the non-labor portions, supplies,
Mhm.
contracts, even looking at the structure around utilities and facilities
Mhm.
is
Mhm.
often areas that we look at. So,
Yeah.
yeah.
Yeah. Golly, it sounds like, and just to kind of put a bow on some of the work that you do from a consulting standpoint, that a lot of organizations are looking for outside interim CFOs and outsourced CFO kind of position that you fill. What do you attribute that to? Do you think it's just purely some of the financial stress on the marketplace? Is there a dearth of well-trained financial folks like yourself in the marketplace? What are some of the reasons why you stay so busy? I mean, talk with you. You're out on the road every day, every week, So
Yeah,
what do you think is going on out there?
I mean, oftentimes there are organizations that require some additional insight and expertise.
Yeah.
Sometimes it requires, having financial executive understanding,
Mm-hmm.
or more holistically, um, to look at the finance picture of it from a different point of view. Sometimes
Mm-hmm.
CFOs are more controller or accounting like CFOs, right?
Yeah.
And sometimes they need help looking at things from a strategic perspective. So that's one
Okay.
area where I would help in. They would be very good at looking at their own finance operations and
Mm-hmm.
connect with their counterparts and looking at the financials. But sometimes they need help with how their relationships are with lenders, right? And
Ah,
how
okay.
bondholders might see their financials, and to be able to examine strategies around that, right?
Mm-hmm.
And to see from an external perspective how bondholders, rating agencies,
Mm-hmm.
how those parties in interest would actually view the organization, and
Mm-hmm.
whether and how they would then treat the debt and the debt structure that they would present
That's
them to.
interesting. A lot of people out there, particularly the audience for this series, may not be have that full picture and understand that a
Mhm.
lot of hospitals do carry bond debt, and so where are they deploying some of that capital, Don? I mean, it can't just be they want to have cash on hand, right? So
Right.
what are they using that leverage for?
Right. I mean, the main source of debt that they end up using, particularly when it comes to non-for-profit organizations, is in the form of building capital.
Mm-hmm. Mm-hmm.
Oftentimes they want to get some debt to build a new hospital. Sometimes they
Okay.
want to build a new medical office building.
Mm-hmm.
They'd like to, maybe leverage some debt to formulate ways in which to look at capital structure in relationship to their strategies, right? And
Okay.
to be able to figure out the best way. Sometimes, not necessarily bonds, but in other loans, they look at really new technologies. And,
Mm-hmm.
where rather than using their own cash, they want to be able to leverage that and get some loans in order to, you know, get the latest technologies, get the latest equipment
Yeah.
that's out there.
What uh, what are a few things that you've helped organizations buy in the last year or so, Don? Was the technology wise? Are we talking about EHRs? Are we talking about robots? What are we talking about?
Yeah, yeah. I mean, oftentimes, yeah, it is. Well, one of the things that recently have been looking at is whether or not there is specific type of robot technology for ambulatory surgery centers, right? And
Okay.
because right now there have and I guess over the last decade or so there have been recent movement towards having what normally would be inpatient surgeries to actually go into ambulatory surgeries, and
Right.
the movement from inpatient to outpatient primarily due to technology and the skill sets of the surgeons.
Yeah.
So being able to understand, well, is there a need to actually, in fact, place robots in ambulatory surgery centers
Mm-hmm.
as a result? So that's one of them. Another one, is indeed, how does one try to get and secure funding for building new towers, building new facilities. Oftentimes in the markets, there's just really capital that's really buildings that are really old that in the end they need to be updated primarily because of technology, but also
Mm-hmm.
to make it more appealing for the patient, and to be able to service patients through not only the new technologies that are present, but also to be able to accommodate a more patient-friendly environment. Hospitals are often trying to find ways to bring new hospital towers, new buildings, and whatnot,
Mm-hmm.
and that often requires funding.
Wow. Well, speaking of being friendly, we will give our friends here a quick break. After this, we'll be right back.
Okay.
Okay, we're back here with Don Briones. We've been talking a little bit about how finance and the importance of having a strong financial leader at your health organization can help you avoid some of those bumpy periods. Don, I want to ask you a little bit more about the discussion with the students, right? Obviously, the Future of Healthcare class is an area or venue where we're providing some wisdom and bringing some insights to the students. What do you talk with the students about in your lecture, and what do you want them to get out of talking with you in that period? What's
Okay.
what's the topic of conversation when you're in front of those eager minds?
Yeah, well, first, I am excited to be part of that particular series. When I was asked to be part of it, I just jumped at the chance. In fact, when I audited the class, there was a lot of energy in the room, and that's exactly what I'm drawn to, and oftentimes. So, first, I just wanted to say that my topic is really around how do you navigate healthcare finance and strategy in
Mm-hmm.
organizations.
Mm-hmm.
And I know that the students there, they are looking at trying to put together an end of semester project,
Mm-hmm.
and part of it involves putting together some kind of a strategy or a business plan.
Yeah.
And what I wanted to get and instill in the students, out of what I'm going to speak about, is not to forget about the finance piece, because the finance position of an organization does dictate what kind of strategy you actually try to move forward with.
Mm-hmm. Mm-hmm.
Earlier, I was sharing about how there is going to be in the future a lot of polarization that's there, right? So, I mean, there's definitely a different type of strategy that you would put together if you were someone that had, $500 million in the bank
Mm-hmm.
versus $5 million in the bank, right? And so,
Yeah.
so part of it is really trying to understand, what are the contexts and concepts of that? How do you recognize an organization that actually is in different types of financial positions,
Mm-hmm.
particularly ones where they are being challenged, and trying to and helping them understand the current situation of the healthcare industry and the financial position.
Yeah.
What are some of those symptoms that are involved that recognizes, how to detect that, and then what are the appropriate strategies in which to apply, whatever they want to go through if they are moving and working towards something to potentially pitch to a healthcare organization.
Yeah. And one one of the things that I always thought about, especially when I'm talking with the students and thinking back to early parts of my career, developing that career pathway. I know a lot of the students have asked me, and certainly will be asking you about, like, okay, what's that first step? What are the first couple of steps? And is that pathway still available to a lot of folks? Why don't you talk a little bit about where you think, the pathway that you took to kind of grow into your role as a CFO at an organization like a health system, and what advice would you have for those students that are thinking about that kind of career pathway?
Mhm. Yeah, well, so I actually stumbled into becoming part of the healthcare industry. I graduated from Cal. I
Yeah.
was I was not in healthcare when I first started.
Okay.
I was an industrial engineer and operations research major, IOR, and
Mm-hmm.
so what.
Classic.
Yeah, it's classic, right? And so, I mean, for me, I mean, I didn't really think of healthcare first. I thought of, what did I learn at Berkeley that would bring me to something that I end up enjoying in an industry that I feel like I can contribute to. And so how I started and how I was drawn was the fact that I had really a lot of background in looking at performance improvement and process improvement and how
Okay.
that connected to finance
Part of the IOR
through my
experience, of
IOR
course,
background,
right?
right?
Yeah.
And how do you eliminate waste? How do you become efficient? And so I was an early adopter of lean early in
Mm.
my career, which really was the basis for me to get into healthcare, because at that time lean was starting to become more prevalent into the industry. So
Okay. Did you ever pursue a black belt or
I I have a green belt, actually, in
a
fact.
green belt?
Yeah.
Okay. All
Yeah,
right.
and I learned from some of the early adopters of I.
Got it.
So I mean, and I had personally met Dr. Berwick. So I mean, it's
Oh, wow.
yeah. So it
Okay.
was something where that's really something that's ingrained in me, particularly in everything that I do that's professional. Really starts with
Mm.
looking at critically thinking and that critical thinking ability. So
Yeah.
I think, for students, right? I mean, people, they do tend to focus on major, they focus on, industry and whatnot. And sometimes it's really about, what skill sets do you feel that you are not only comfortable and good in, but how
Right.
you can apply to an area that you really like. And sometimes, healthcare, at least for me, at least, was my calling, but for sometimes it could be the same for others as well.
Yeah. Now, are folks, can they look to the first part of their career and working in finance departments, or are they working in clinics? What are some of the early stage steps that you see out there, either at a firm like yours or at a department within a healthcare system department
Yeah.
like yours?
Yeah. So, I mean, if you look at kind of the dual track that I had gone through, right? I mean, if we're talking about healthcare organizations in the industry, yeah,
Mm-hmm.
certainly, the first step in going into that in terms of healthcare finance or healthcare strategy is really, getting within an organization that really has a strong sense about what it takes to actually build and implement a strategy and how to actually then formulate and how to fund it through the area of finance and monitoring, right? So,
Mm-hmm.
looking at being in a financial analyst position, a
Mm-hmm.
strategy analyst position, going into program management and from an operations perspective to learn that way is another way to do it, right?
Mm-hmm.
On the consulting side, I see that getting into firms that have strong healthcare consulting practices. There is always a sense where there's recruitment of folks who are really good from an analytical perspective, because
Mm-hmm.
a lot of the work that in the consulting firms, what they do is evidential and analytical based, right?
Mm-hmm. Mm-hmm.
Having the knowledge base in the healthcare side does then come forward as you having more engagements and projects on hand. So I
Yeah,
think,
and I would agree with that. It's just interesting. I always looked for, when I was doing consulting, folks that had not just academic projects related to analytics, but just a pure interest in looking at different slices of the data and assessing performance through different filters and different lenses. And so when you're looking and talking with candidates out there, what are some of the questions that you're asking them about their background experience associated with what you're trying to get at, which is a really, at least a keen interest in analytics, if not some deep experience in having done some of those things, because they're going to be asked to do that for you and on behalf of the system, right?
yeah, yeah. Well, I mean, I actually look at where I look at individuals, or when I interview individuals, I often look for those that can see beyond the actual analytics itself. So
Okay.
understanding, perhaps how to do the analytics, right? How to, organize the information, analyze the
Mm-hmm.
information, and then draw conclusions from it is one thing. But then taking those conclusions and getting to the so what of it, right? So,
Mm-hmm.
so what? Why is the number or the conclusion the way it is? I
Mm-hmm.
often look for in candidates those who can then go that next level and say, well, what is the so what, right? What does
Mm-hmm.
that mean to the audience that we're trying to serve, right? What does that mean to the
Right.
physician who's asking for that information? What does it mean to the healthcare administrator, to the bondholder, the lender, right? And be able to draw those conclusions, and then what are some of those considerations that are needed that would give them that additional value more than just what would be the ordinary data analysis.
Right, right. No, I find that folks that are naturally drawn to the so what are really going to be your superstars and your home run
Yeah,
up and comers. So
yeah,
I can appreciate that
absolutely.
for sure, for
Absolutely. I mean,
sure.
absolutely. I mean, drawing from my lean experience, I mean, it is the five whys, right? I mean, you
Yes.
keep going, why, get to the root
Hmm.
cause, right? And then be able to then draw that out, right? Because and be able to understand your audience, right? Is the other piece to that.
It seems simple, but oftentimes folks are either not thinking about it or lazy about it, and they don't go beyond some of that next level. Then they might miss the root cause, and they might miss a solution that they didn't think about. So one thing that I'm kind of curious about too, in addition to your working with junior team members that are coming in either on a consulting basis or in the departments as you're overseeing a finance team or whatnot, how has the introduction of technology over the last several years, and particularly in the last couple of years with AI and some of the tools that exist today, How has that changed your day-to-day and the day-to-day lives of some of those junior team members that you work with regularly?
Yeah, it's actually changed significant. It changed the environment significantly, Jason. I mean, there were not even 5 years ago. We can
Hmm.
we can go back. Yeah, we can go back to maybe just before the pandemic.
Hmm.
In doing research for a client and also doing and understanding how to organize the information that you've gathered for a client often took a process in the consulting practice where you'd have staff consultants compile, organize all that stuff.
Yeah.
With AI and with other tools, it has become either quite accelerated or
Hmm.
something where those particular routines have taken over
Hmm.
that. So there's been quite a bit of change as a result. With the staff consultants, particularly these days, as well as my own. I mean, we have had to look at what is the best way forward that would most effectively utilize skill sets of individuals. So
Hmm.
oftentimes, in the very beginning, if we're talking about maybe the first 6 to 12 months of a staff consultant's life,
Hmm.
it is about, sometimes it's about how you organize an Excel file or how you
Right.
where you actually provide research or how good are you at PowerPoint, right, or whatnot.
Hmm.
And now it's not just that, right? It's taking the information that you get from utilizing, the GPTs and other platforms, and now, utilizing one's critical skill sets, utilizing ways in which to draw and really get to that, what I was describing before, that so what, right?
Hmm.
Now that you have some of this information, what is the so what? Right. And
And
being and really raising the license of the work for people, right? So
how are you getting people prepared for that? Do you actually, in your company or your own mentoring of those junior people, do you have some processes that you recommend, or what wisdom can you share with some of the students or some of the audience here around preparing themselves for that reality? Because I don't think AI is going away, and certainly, how do you, as a person entering into the workforce today or are early in your career, can embrace the technology? How are you coaching people up, and how are you mentoring them to be successful at that?
Well, first, I agree completely with you. I don't think AI is going away. I
Yeah.
think I think it becomes extremely important that the senior leaders of the industry, whether they're in industry or whether they're, in consulting firms or anywhere else, that
Hmm.
they do try to accelerate the early careerists faster in their ability to be able to understand what this means within the industry. So
Yeah.
what I've done to mentor early careerists is really to understand how I interpret the information because
Okay.
when whether if it
You
was
give them that smell test ahead of time in a way.
right, exactly, and
Yeah.
be able to say, okay, well, and there's a couple of engagements, for example, where I've put some of the staff consultants in my seat, right,
Hmm.
and ask them to actually do that, and then I would then work with them to say, okay, here's how I would interpret it. Here's
Yeah.
the implication for what I see. Here are some of the issues that might be with the information that I've gotten from the analysis, and then ultimately, after remedying it or enhancing it, how does that then translate to the client? So
Right.
that's kind of one way that I've done that relative to being mentoring and to mentor some of the staff consultants.
Yeah.
When I was a staff consultant, I mean, I knew that all I needed was some at bats. And I think that's also the other way to do it is really to give them
Hmm.
the opportunities to get more at bats. And,
Hmm.
for those who are striving to go into this field that, once that they have a good sense of, the lay of the land to really ask for it, right. And to try to push it
Hmm.
because
Hmm.
because they will get the opportunities.
So, how are you adapting, or how are you incorporating AI in your, I mean, just either personal or work life? What are some examples that you're seeing? And how many of those are health system? We talked a little bit about how health systems, you and I both experience health systems that are slow moving dinosaurs, and, we're slow to adopt EHR. And I got to imagine, and you can read every day in headlines and whatnot, a lot of organizations are hesitant to abruptly or aggressively adopt some of these AI tools and frankly, lots of technology tools because of lack of track record and some concerns over privacy and hallucinations and a whole array of different challenges that might come with some of these technologies. So what are you adopting today for yourself, either on the personal side or on the work side?
Well, I'll talk about the work side first, and then I'll talk about a little bit on the personal side. So,
Yeah.
on the work side, I mean, I do in working and talking with my clients, try to understand what their ability is to either A, adopt AI and AI tools, and B,
Mm-hmm.
whether their culture is ready for it. I mean, there's many organizations out there where they are fully prepared and ready, right? I mean,
Mm-hmm.
they have the governance team set, they have criteria set, and they are ready to go, right?
Yeah.
They're fully embracing it. There's others that they are still not sure, right? They haven't gotten the governance set. They might be using it through third-party vendors, particularly in
Right.
revenue cycle,
Right.
but for the most part, they are still skeptical, right? And
Mm-hmm. Mm-hmm.
each of those different categories of clients that I have really have to be able to say, well, okay, in terms of solutions, whether particularly performance improvement, whether or not to adopt advanced technologies, AI, whatever you want to call it,
Yeah.
into that particular plan, and
Yeah.
whether or not, and how to migrate those that would be more beneficial to adopt sooner rather than later.
Mm-hmm.
So I mean, I see that, another on kind of a transition of professional to personal. I mean, we all read, on a daily or every other day basis
Sure.
what's going on in the industry, right?
Mm-hmm. Mm-hmm.
Something happened here. There's something, this organization's acquiring that, right? And and so there's sometimes where I just simply go in myself to do some of my own research. I found it very fast to use some of the GPT tools to say, what was the basis for this? What happened, right? Like, why did this organization fall so far down, right? Why
Mm-hmm.
did this organization decide to acquire this? And to be able to do that from my perspective, using my tools that I have available to me, as opposed to 5 years ago where I've asked a staff consultant to help me put that research together.
Yeah.
So that's it. On a personal note, yeah, I mean, everything from movie trivia to when you know when was the last time Cal actually won the last football championship?
Geez, yeah, that's been a few years.
Which was in the, I don't know, 40s. And so yeah, I mean, I use that often for fact finding
Yeah,
personally.
fact
Yeah,
finding,
yeah,
Gen AI stuff
yeah.
for sure, for sure. I think for me, I have been adopting more of the tools, definitely in preparing first drafts of deliverables and documentations from a business development standpoint.
Mhm.
I've been playing with some of the Gen AI tools out there to create websites and do some vibe coding of my own, and have been developing a few apps associated with some work processes. I'm curious, do you work with the clinical groups and clinicians that have aggressively adopted things like open evidence and Hippocratic AI and some of the tools that are supporting clinicians? And does the organization, do the hospitals and health systems that you are the CFO or have been over the last couple of months allow for that and are openly, supporting the doctors to say, yeah, go ahead and use that AI,
Mm.
use that open evidence, use that Hippocratic AI to improve patient care or accelerate things, because we know it will improve your satisfaction as a physician, the care, the speed, the access for patients. What are some of the things that you're seeing in the places that you've been at the last 6 months?
No, I mean, I have seen some of my clients actually using those sort of tools.
Yeah.
From a CFO perspective, I think as an industry, there is still somewhat of skepticism about how it ultimately hits the financial statements. There are
Yeah.
some cases, but I think the jury's still out for many of the CFOs that believe, or that originally were pitched the fact that there was a financial gain to it,
Mm-hmm.
but that in the end, how it directly hits financials in the way of cost management, revenue enhancement, and whatnot.
Mm-hmm.
I believe, however, that many of my clients, particularly, not only on the clinical side, but particularly in administration and even the CFO in the CFO's office, that there is adoption to it because of the downstream effects as a result. So, many of these tools often involve ways in which to avoid physician burnout, right? To
Mm-hmm.
avoid
Mm-hmm.
caregiver burnout, to try to eliminate or greatly reduce the routine tasks in favor of, whether you're clinical or non-clinical, raising the bar and having folks work to the top of their license, right?
Yeah.
That all of those relate to job satisfaction, wanting to go back to the job. And, from a downstream effect, there is a financial effect about, replacing physicians, replacing caregivers and whatnot. So it
Yeah.
becomes, yeah. So, I mean, I think there's adoption from a financial perspective. I'm not sure that they've actually adopted it to directly affect the financials, but I think they're saying that it's a necessary component for them to continue and utilize these technologies. Now I'm talking about the haves, right? The have-nots, they're, a lot of them are still just trying to survive, right?
Yeah.
Yeah, yeah. So they've often had to prioritize between, those sort of tools and whether they can replace a broken OR system
Yeah,
after
those
these
are tough.
surgeries.
Those are tough decisions. I was debating this the other day with somebody at a conference about how aggressively AI is being deployed in the revenue cycle. And we were joking about how the health plans and the health systems would adopt more and more aggressive AI
Yeah,
bots to try to approve prior authorization and reject prior authorization and stronger utilization review
yeah,
and sort of back and forth and just sort of escalate it, the emulate the same process that would have gone on between humans 5, 10 years ago, but it now is just like boop, 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 like the bots are just pinging back and forth in a
mhm,
matter of seconds, if not minutes, or minutes, if not seconds, to make that decision. And then it finally gets to human anyway after it's gone back and forth 3 or 4 times.
yeah,
Have you had any funny instances like that where literally there was multiple technological checks against others
yeah.
in a prior auth situation?
I must say personally, I have not, and it
Okay.
would drive me crazy if I was a recipient of that. I do have some of my colleagues where they have witnessed that and seen that and have seen that. And you're right. I mean, it really is more of an accelerated iterative process, right?
Yeah.
And
Right.
in the end, it does come down to what the experience level is that is actually brought into these platforms. And,
Hmm.
if there isn't really resolution that exists that's there, it'll ultimately end up in a point where humans will then talk to humans. So,
Right.
yeah.
Right. No, it's just funny because I was at a conference and literally like across the hall from, or across the exhibit, a hallway from each other, there was a revenue cycle AI bot for the health plans, and then another guy on the provider side. And it was like a weird juxtaposition because they were
Yeah,
like
that's
across the
funny.
hall from each other.
Yeah, that's funny.
Anyhow, so as you think about final thoughts for the students, what's one thing that you hope that the students really take away from your discussion, and just a nugget of wisdom that they can hold on to as they walk out of that class?
Well, the main thing that I was hoping that they can get out of the class and what I can provide is, in the end, not everything goes to plan. You can put a
Hmm.
strategy or a business plan together. You can,
Hmm.
end of semester project and everything is hunky dory and looks good.
Right.
But not everything goes as planned, and you need to actually look at and work on contingencies. And the way in
Hmm.
which one of the data points and one of the ways around that is to look at and to understand the financial performance and how the ebbs and flows of financial performance have. You can go back in time and look at the most successful companies, in the history. You can
Hmm.
look at Apple, right? You can look at Netflix.
Hmm.
They started out gangbusters in the beginning, and then they hit
Yeah.
a snag, right? Apple hit a
Yeah.
snag. Netflix hit a snag.
Yeah.
They went through turnaround. They went through restructure. They had crises, right?
Hmm.
They found a way out. They found the light at the end of the tunnel, primarily through the fact that they had they had to figure out how they were going to generate a way in which to build the strategy and to fund the strategy through financial performance. So
Yeah.
that's one of the things I wanted to leave with the students is the fact that you're not going to you may not get it right the first time, and you may not
Right.
necessarily need to abandon the idea. Sometimes you just need to restructure the idea,
Yeah.
and one of the ways in which to do that is looking at the financial performance and to how the life cycle of financial performance
Yeah.
goes through. I mean, I guess in some ways that's kind of my words of wisdom, right? Is never give up. And never look at and look at things linear, because there's always a solution. Sometimes the solution isn't exactly what you think it is, and sometimes in the case of Netflix, it isn't always that the solution is going to be DVDs.
Yeah.
It's going to be
Yes.
streaming.
True. Very true. Very true. Well, listen, Don, thank you so much for joining us on Margin and Motive today. Really appreciate your thoughts and the conversation.
Great. Jason, thanks for having me. Appreciate it.
Awesome.
Okay. Thank you.
Well, Don, thanks for coming on to Margin and Motive, Future of Healthcare Decal series today. We've been talking with Don Briones a little bit about how health systems face and pass through financial troubles, technology, and how that impacts the health systems these days, and a little bit of wisdom for the students out there that are looking at careers in healthcare. So if you enjoyed the conversation and want to hear more conversations like I've had with Don today, please like and subscribe to marginandmotive.show on YouTube, Spotify, and Apple Podcasts. And we will look for you on a future episode. Thanks so much, Don.
Thanks, Jason. Thanks for having me.
Take care now. Bye-bye.
Bye now.